So I do not think it's a good idea for people who are experiencing intense mental health problems to just recreationally experiment with drugs. That's a really, really bad idea.
Oh my
Okay.
God. Really quick, Nick. I'm so
Yeah.
sorry to interrupt. I thought the scheduled thing had us live and there were people talking in the room. So I thought they were here. We have not been live during all this, which is fine. So I'm just gonna pause for 1 second while we get back
Yeah.
into this. Hi everyone. Wow, I'm such a fucking dipshit, and it's fine. I'm gonna post this. Look, right after we're done, I will post this live. So the first half, like I will go post this episode
Sure.
so that y'all can catch the first half of what we talked about. Um, I thought that this thing was scheduled, and it just went live on its own. And after reading what you guys said about Bird, I thought the joke was because I was looking out the window because Allie was there. And I was like, and you said in the thing, what is it, a technical difficulty or a bird? And I said, bird. But it wasn't a bird. It was me not pressing the button that said go live in the up right hand corner. Good God. Well, okay, we're going to keep going. We've been talking about, I don't know what is wrong. I'm not going to use this as a spiraling thing. I was talking about how my depression's like settling all back in this week. Ew, it's all good. So the first half of this, I'm going to post this in last week's, like right after this. And if you'd like to catch up on the first half of our conversation, please go ahead and do that. I'm so sorry.
Dude, don't worry about it. I can give a quick. We were just talking. Somebody asked
Yeah.
about like how to understand some of the new research results coming out about using magic mushrooms, other kind of hallucinogens, microdosing, and they also asked about EMDR, effectiveness of EMDR, something like that, right?
Yes, yes. And so, yes, so we're finishing up talking about some psychedelic stuff, which we will, you can totally go back and see some of the first half of that. What were you saying? You're saying like, don't
Well,
experiment with the,
yeah, I'll just like kind of brief recap is there is very promising but small in scale emerging evidence to support the effectiveness of both psilocybin, the magic mushroom ingredient, and MDMA for treating end of life depression, chronic PTSD, and some addiction issues. Okay, so the results have been very promising. However, the total N, like the total amount of people that have been studied, is still very, very, very small. Okay, so it's promising and exciting, but it's not conclusive by any means. We still don't know like who it's most effective for. And the other thing is these substances, when they're studied in clinical trials, are lab tested and delivered under an umbrella of many layers of protection and supervision for the subjects. So I do not think it's a good idea for people to go out to their plug and just start testing, you know, to see how
hmm.
psychedelics and other or MDMA certainly affect their mental health, especially if they're really not doing well. That would be a very, very bad idea. We have way more evidence to show that people using psychedelics or MDMA or whatever the fuck they think it is when they buy it from their plug
Right.
end up in the psych emergency room because bad things happen. So I don't suggest that people do that. Okay.
Okay.
Um, but if you're already in care, it's maybe worth talking to your psychiatrist about. None of this stuff is available, for treatment now, but it's possible you could get in some clinical trials if you really have treatment resistant um, uh, symptoms.
Okay.
However, we have much better evidence to support other treatments. So I would first, like, this is what I always start with the treatments that have the most evidence and work your way down. you know, it's like kind of sexy and exciting to think, oh, like mushrooms could cure my depression, and like,
Right.
fuck, I like taking mushrooms too. But if you have these problems, it's not a good idea to take drugs unsupervised. It's just not.
Yeah.
Okay. Um, so we'll see in a few years. Maybe you'll be able to get prescribed this stuff
Because
if
it's
it can.
definitely, when you read the books and stuff and you're like, some people, it's like an intervention level event and it just cures their fucking depression. I'm like, oh, give it all to me. Let's just jam that in here and see what happens.
I'm very skeptical of
Yeah.
that claim, and I've never seen that claim proven past a year time horizon. Because I just don't believe that I don't think strokes of insight cure decades long behavioral patterns.
Yeah.
I've never seen that happen. And I'm very skeptical. Like, you might feel better for a little while, But I just don't think that people are going to totally, because mental health problems are expressed behaviorally in patterns of behavior. And if you don't change the underlying patterns of behavior, I just don't see how you're going to have a different mental experience. No one's ever explained a causal mechanism for that process. I've never seen it personally, and I've never read any research that supports that claim, again, past a year follow up.
Yeah.
So I would love to be wrong about this, and I'll be the first in line if I am, but I just haven't seen that evidence. So I would be very, anytime someone's telling you a miracle cure, be skeptical. Like
Right.
that's, so that's one thing. It's very encouraging, but it's new evidence. Okay, so I don't think people who are especially in acute distress should be experimenting with unregulated psychedelic compounds. Right? If you're doing good and you like it and you've tried it before, rent yourself a house in Joshua Tree and get busy. But
Yeah.
work your way down from the highest quality evidence in terms of treatment options. Is my
Yeah. What would that be, do you think?
It would be antidepressant for depression. It would be antidepressant medication and cognitive therapy. That's those two things together have the best support in the research literature.
Yeah.
For addiction issues, the research is not great, but actually a big meta-analysis just came out and showed that the AA style groups have better outcomes than a lot of other treatments. So harm reduction in AA or 12-step style interventions seem to have the best evidence, but
yeah,
it's not as good. End of life depression. I mean, if you have like inoperable cancer or something, fuck it, take the mushrooms. I mean,
yeah. Oh, yeah, EMDR. EMDR is something that I always hear about that I guess I don't really know the details of. I've done very limited EMDR exercises. I had a therapist who did some like tapping and bilateral stimulation stuff with me that I felt I really liked. But tell me, I don't really understand it.
Well, because nobody really does. But here's the thing: if you're doing something that makes you feel better, keep doing it.
Yeah.
I mean, that's the bottom line. If you're doing something that makes you feel better and it's working for you and it's not harming you, then you should do that. Okay. But EMDR, basically, the assumption is that there are two things that are put together. One is like coming up with a narrative of the trauma experience that helps contextualize it, which is essentially what all of the exposure protocols do, like prolonged exposure and cognitive processing therapy, trauma-focused CBT. They all involve this element of revisiting the trauma narrative, retelling it so that it gets encoded and time and date stamped in the brain, and the body learns not to respond to that trauma narrative as if it's happening right now. Okay, that's kind of the underlying thesis of exposure protocol. Habituation to distress, right? Like watching a horror movie 100 times, it's not going to be scary anymore.
Right.
But then EMDR introduces this thing that you referenced called bilateral stimulation, which is while you are doing that trauma narrative, you're either following like a dot or getting pings in your ear and paying attention to that. And there's some like theory that the part of your brain that's paying attention to that somehow allows you to like distance a little bit from re-encoding the narrative. There's no, that causal mechanism has never been demonstrated in any study. And when you do EMDR without the bilateral stimulation, you achieve essentially the same effectiveness as you do with the bilateral stimulation. So my personal view is that it's kind of a little bit of a pseudoscience kind of gimmick that people like.
Yeah.
And it makes them, feel like they're doing something kind of magical, and that helps. And fuck it, if that helps, do it. I mean,
that's interesting because I was literally doing the meditation yesterday. Like I was saying that I learned like this one style of Qigong meditation, this one like exercise when I did Kung Fu like 16 years ago. That is still like my favorite way to meditate when I meditate. And I think a lot of it has to do with the visualization of this repetitive movement of my hands and the focusing of like gathering energy, using it to flush my meridians, storing it in my dantian, and then repeating. Gives me something to do that that feels so functional, and to like create a point of focus for myself. It's much easier for me than just focusing on my breath or just becoming still. So I feel like there is something similar, like because I feel the same way about the tapping that I learned for the the bilateral stimulation thing of like it just feels good. It feels good. It feels like, oh, I have an actual I have a thing I'm doing.
Yeah, totally right. I mean, the other thing is it can be done both with tapping and with listening, and those use completely different parts of the brain. So why would they have the same causal effect on a trauma memory?
Yeah, interesting.
So, but that being said, if you like it, fucking do it. There's no harm in doing it.
Right. Yeah.
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 I,
Um.
the again, the treatment that I'm trained in is prolonged exposure. So, and I've just had a lot of success with that. But it can be pretty unpleasant to do. So if you want to, start with the MDR, start with the MDR. Go for it. They use it in the VA, so fuck it.
All right. Here's this other question I thought I'd throw in here. Switching gears so rapidly, I don't know. I was in therapy for 7 years for general anxiety and obsessive thought patterns, and it was so helpful. My counselor decided it was time to end our sessions, though, after such a long time together, because counseling becomes less effective after long periods, and I don't really know what to do now. I haven't been medicated since I was a preteen, and it was kind of an awful experience. I loved being in therapy and found it super helpful, but if it becomes less effective after a few years or so, will I just have to keep finding new therapists?
Yeah. So okay, here's the the issue. So generalized anxiety disorder is a disorder. Obsessive thought patterns is not a disorder. So is that obsessive compulsive disorder, or is it kind of automatic, persistent, intrusive thoughts that could be associated with anxiety? These are different things. The other thing is, you know, a lot of times people want to stay in therapy because it feels good. It's like being in a warm bath or being held by somebody, right?
Mm.
And of course, who wouldn't want to do that? I think we have to kind of interrogate a little bit more, though, because if the therapy was effective, why do we need to keep on going, right? General anxiety disorder, even obsessive compulsive disorder, these are DSM illnesses that have treatment protocols designed to reduce their symptoms. And I think if you're a therapist and you're treating somebody with one of these disorders, you have a responsibility to evaluate the effectiveness of your treatment.
Mm.
So after a certain amount of time, like if I'm seeing someone for one of those disorders for a year and their symptoms are not getting better, we need to do something different. They need to see somebody else. We need to try a different therapeutic approach because those symptoms should be resolving.
Mm.
Right? It shouldn't be they see me for their whole life to like keep a lid on their symptoms. That's not responsible therapy. So
Mm.
you got to ask yourself, what is the goal? What is it that you want to get out of this treatment? If it's for your symptoms to resolve, there should be an end date for that.
Mm.
If you just kind of like seeing your therapist, well, there are other therapists that will do that, especially if you're paying out of pocket. There are therapists who will just let you come to their office for 20 years, once a week, and you kind of vent to them and it feels good, and then you go home. And so, you know, sure, you could go see one of those therapists. It's not so much that therapy is not effective after a certain amount of time. There's no like time drop off. It's that if your symptoms haven't resolved for a particular disorder after 7 years, there's something that's not working in that relationship.
Yeah. Interesting.
It's more like that. Does that answer the question?
I think so. Yeah. I mean, how is that different though from like if it is just a comforting thing? Like, how is that different than just like the pill I have to take every day?
Yeah, it's not really. I mean,
Yeah.
it's kind of expensive, you
Yeah.
know.
Exactly.
But
Yeah.
I mean, let's put it this way: when I worked in for the county in LA County, you cannot come see somebody for that long because we need to free up our schedule for people who are in acute need. So if I see
Yeah.
you for a year and your symptoms are not getting better, I gotta refer you to a different therapist because it's
Yeah.
not working.
I understand. Yeah.
Something's not working. Or after like a year, your or however long, your symptoms do get better, and we discharge you. We discharge you.
Yeah.
You've proved your symptoms have resolved. You have the tools to manage these intrusive thoughts and like go try it out in the world. If you need to come back, we'll do some boosters, and I got to see the next person. Now
Yeah.
in Beverly Hills, in the private practice I worked at, there are people coming for years, many years. People just they're paying out of pocket. They like it. It feels good.
Yeah. That's interesting. That's I guess that like is part of the like requirement to like investigate like why you're there. I was talking to my
Yeah,
brother about this a little bit the other day,
exactly,
and like we were
exactly
talking
right.
about our dad, and that his like history of always being like, I can't do therapy because he always thinks he's smarter than his therapists, you know.
Well, he
and
might
I
be.
and I was like, he very well might be, and I was like, that's just his like. Whenever I've gone to therapy, to me it's like this is a weird analogy maybe for some people, but like I don't think anybody who's earnestly religious and likes to talk with a priest or something like that. Maybe some of them think, I don't know. I think most people on some level, you don't go to the priest because you think that that person is God, or that they're like, you go because you need someone. You're committing to this representation. Like you need, like almost like Wilson the volleyball. Like you need to externalize a thing so that you have somebody say like, I need time to speak with God, so please represent that for me. Like I've met gurus in the past that people are like these amazing gurus, and then you meet them and you hang out with them and you're like, oh, you're just a guy. And they will say that too. They're like, yeah, but it's like we need someone to be the vessel. And so I think
Yeah,
with therapists, it's like when I was going to therapy, it didn't work while I was trying to work my therapist for whatever reason, because I wanted them to
yeah,
like me, or I was too young to know what I was doing, or I was attracted to my therapist, or like whatever the thing was, that I was like not there to do therapy. I was there to be smarter than them, and that was my thing.
right.
Whereas when you realize like it doesn't fucking matter if they're smart, it's like are you showing up because you earnestly want to get better? Are you there to do the exercises, to spend the time to try? And if you're stuck in this mode of thinking I'm smarter than my fucking therapist, this never works, that just means you don't want to get better. That just means like you're not humbled to the process.
Well, yeah, that's just not what therapy is about. I mean,
Right.
I also think, yes, we want the end goal to be you to feel better, but really, before feeling better, what you need to do is diagnose what's responsible for the problem and change those things,
Hmm.
whether they are patterns of thinking, habits, ways of framing your experience, whatever. That comes before feeling better. So, what is the diagnosis? Yeah, the DSM diagnosis, but more importantly, in your specific context, what's responsible for causing the problems? Then you need to commit to changing those thoughts and behaviors. And then we will expect to see you feeling better. I mean, that's how the process works. So, going to feel better is kind of like putting the cart before the horse. What are you going to change? What are you going to learn how to do differently, and what tools do you need to support you to do that? So that's for this person asking the question, that's what I would ask them.
Mm.
What do you need to work on now? What changes do you need to make now to your behaviors and your thoughts? And if the answer is like, well, I don't really want to do that, I just want to feel better, like that's fine, but just be upfront about that with your therapist. Like, I'm here to vent and feel better.
Okay.
And some therapists may want to do that. I would say, let me refer you.
Okay. So in the chat, okay. First, well, I wasn't gonna say who asked it because I try to keep it anonymous, but the person who asked it said, "I did get better. I just still have the issues," and which is interesting. And
So yeah,
then
what does that mean?
exactly. Well, I think it means, well, and correct us, and Emily, if you want to like weigh in on this more, I think this is interesting because I think
Yeah, let's hear it.
is
Yeah.
is like I'm reading that as to mean like basically the therapeutic process was comforting, like what you were saying.
Yeah.
She goes, I'm a lot better, not like totally healed. And so what is that? That suggests to me either yeah, like when are we ever totally healed? And that's good that that worked for you. Did you feel like the therapist saying, I think we're done with our time together, like you can't do this forever? Is that, did they feel like like, do you feel like you need to go meet someone else who will do more work? Like, it's not as bad as it was, but I'm still really anxious, is what they just said.
Okay. Yeah. So it's probably worth making an appointment with a therapist. But here's what I would encourage this person to do: is to think in like more or less quantifiable behavioral
Mm,
way. What is the goal? For example, is the goal to have no more intrusive anxious thoughts, or is the goal to like to have zero anxious thoughts in a week or something? Because that would be one goal. Is the goal to be able to like go get to work on time, maintain more or less healthy relationships, not cancel plans because they make you feel anxious, kind of things like that? I would first think for yourself, because this is what a good therapist would ask you to do. What are your goals for coming back to therapy.
Right.
And the reason it's important to have those behaviorally defined goals rather than uh, emotionally defined goals
Hmm.
is because that lets you know when you're making progress. Does
That's
that?
yeah. Emily just responded. I don't. Emily, let us know if that makes sense because she goes. I tried a few other therapists, but I just don't know what I should be looking for treatment wise. But I think what you just said, that to me has been always the most because I don't know. Just on a personal level, I never liked sort of similar to what we were talking about earlier, which y'all will hear if you listen to the first half of this when I post it. Is just my own insecurities that still come in around taking medication, around feeling like I'll never be better, blah 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 blah. Feeling like basically I'm a quote unquote weak bitch. That's the voice in my head, and like the thing that's helped me the most is because I don't like the idea of just an indefinite I'm here to just not know what I'm doing has been that is like if I go to a therapist, especially because it's expensive. In the past, it's like expensive a lot of time. It's like I want a tool, I want a thing to happen. And what you
Yeah.
just said has always been the thing that strikes me as most helpful about understanding DSM, understanding the terms mental illness and what we describe in the world. And when people use it for political reasons, like we need to fix mental illness or whatever, is understanding that the thing most people don't understand is that it is a set of traits that you can objectively look at behaviors and say, this is what we're trying to do. I want to be able to leave the house, or I want to be able to, whatever. And if that they are what you just said, behaviorally defined changes, not emotionally defined changes. And even when I started medication, it was a great surprise and to me that after my first several weeks of the trial, and I was checking in with my psychiatrist on my first antidepressant, that I didn't like feel like sunshine and rainbows every day. I didn't feel that fucking different. But my therapist or psychiatrist said, have you had any of those can't get out of bed days? Have you had how many of those have happened since our last, And I sat and I thought about it and I was like, oh yeah, that hasn't happened. Like I I realized like just because I wasn't feel like it wasn't gonna be just like, oh, you're not high all the time. It's like you just are suddenly, I don't know, it helped me function. It was a behaviorally definable thing. And that was like, wow, that's true. Okay. And it kind of flipped a switch for me that I would have to define I wouldn't, not just that I would have to, but that it always had been all along, something that I could only define by behavior and behavioral changes rather than just
Yeah.
feelings.
Right. I mean, here's the thing. Like, if you are going for treatment for a DSM disorder, all DSM disorders include a functional component. You can have all those symptoms. If they don't interfere with your functioning, you cannot make the diagnosis, right? So, not that we should be DSM slaves. Like, that's just one kind of
Right.
frame, you know? But I would ask yourself, what functional outcome do you want to achieve? What is the functional outcome you want to achieve? For example, in the case you just gave, Jared, it's like, I want to be able to go through a week without having a day where I just can't get out of bed because I'm so fucking sad.
Yeah.
That's a functional outcome, and
Right.
we can work towards that.
Right.
But if it's like, I want to feel healed, I don't know what that looks like, and I'm worried that we are, as a result of not knowing what that looks like, not going to be able to achieve it.
Yeah, that makes so much sense to me. And that to me is part of like I don't know. Again, I'm not trained, but my experiences myself, and I think the problem and the challenge with like a lot of mental health stuff is like getting trapped in this forever hole of wellness woo woo nonsense of wanting to like feel something that you can't explain versus
Right.
like I was talking to my brother about this a little day. I think it's not about ignore your feelings, and it's not about like saying like
No.
if you are functional but still miserable all day. That's not what it is either. It's like my brother's been going through this thing. I feel like I can just say where he was like just saying like I'm starting to solve some of my external problems and realizing like I don't know what I want for myself in my life. And Allie's like, well, think about what gives you butterflies. And I was like, yeah, dude, you need your own mission. You need to know like what is the thing you're trying to do in the world, because I feel like I may be far away from the things that I want to do in the world, but I know at my core like what I really want to do, like what I really, and it may be challenging for me to get there, but if I can define like I don't know, some of my behaviors were like I wanted to stop being shitty to people that I loved. I wanted to stop like, which again, how would I define that? Stop having like a weekly fight with the person I love the most. That's like miserable and traumatic for everybody involved. I wanted to stop feeling like every disagreement I had with anybody was like, they fucking hate me, this is all over forever, like
Yeah.
change my reality a little bit. And then, of course, be more functional, achieve things, show up on things that I said I wanted for myself and other people. These kinds of things, some consistency. Like, so now that I can see that I was able to change some of those behaviors, I don't know, it starts a ball rolling of a belief of behavior change. So
Yeah.
I feel like that's one thing. A couple people are saying in the chat real quick was, how do you know when you need a psychiatrist? I feel like that's a broad question, but I mean, when talking through things just isn't enough. And then Emily, who was asked this question initially, said, yeah, that. I am curious to hear what you say. I'm just going to hop in and say, like, my experience with it. I avoided seeing a psychiatrist for so fucking long because of, again, the voice that's still in my head that, like, I'm just like my dad. I'm just like an addict, and I'm going to, if I take pills, they're going to be misprescribed and overprescribed, and I'm going to supplement the Adderall I do get with cocaine, and I'm going to supplement the Xanax that I get when I run out of it with opiates. And, like, I was just like, I'm going to be a fucking maniac, and I'm going to zone out and never humble myself and never fix anything. I don't want to be that. I don't want to turn into a zombie other version of myself. So I avoided seeing a psychiatrist for so fucking long. And I tried therapy, and I tried all these like personal I tried so many I did like horse therapy, I did constellation therapy, I did like, regular talk therapy, that little bit of EMDR. I tried so many things to try to be a better person. I tried drinking, I tried not drinking, I tried Al-Anon, I tried AA, I tried like so many fucking things. Al-Anon, not AA. That's a lie. I didn't do AA. I did Al-Anon, 12 step. But I tried so many fucking things, and nothing was allowing me. I would know these tools. I worked out like a fucking maniac. I knew the tools, and I just couldn't do them. And I had a therapist a long time before that who had said to me, "Have you considered seeing a psychiatrist? Like, have you I think maybe you might be a candidate to maybe talk about some of the things you go through." And I was like, "No, I don't want to do that." So after
Yeah.
years of that, I was like, "Okay, I'm going to try a psychiatrist." And at the intake, they give you the little questionnaire, and I'm filling out the questionnaire, and it's just like me, 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 me. And they're like, we're going to do a trial of some medication. And I feel like a fucking, just like I did when I went to therapy the first time, like a fucking dog at the vet. I just feel like shaky and scared. And I like had to, and the tools were like, I could use the tools now. That's all it is. It's not a solve your problems. It's a bridge a gap for behavioral stuff. And so maybe you are a candidate to try if you haven't. If I would say if you're having that anxiety stuff and the therapy helped, but it didn't get you all the way there, maybe you're a candidate. Maybe you're a
Yeah.
candidate. Anyway, that's
So
my experience. Please, yes.
the best evidence suggests for anxiety and depression suggests that the optimal outcome is to do both medication and evidence-based psychotherapy together. Those are the best outcomes. So yeah, I would just make an appointment. I mean, find somebody good and a good like get a referral from most therapists should have psychiatrists they work with and can refer you to.
That
And
is
like
how I got my I did
yeah,
that. Yes, my old therapist who had initially recommended it. I hadn't talked to her in a while because I also stopped my therapy. I called her and she was like, "Here's some names. Here's someone who's helped people," and that's how I found her.
right. So I had like three psychiatrists that I worked pretty regularly with, and what I look for in a psychiatrist is somebody who wants to give the least amount of intervention possible to start.
Yeah,
They start like they would want to take decrease medications or start with a very low dose of a
yep.
medication, trial it. So that's the kind of the type of person you want to be looking for. But yeah, try it. I mean, you should try it. Get a good referral.
That was my experience with my therapist, or my psychiatrist. I keep just calling him therapist, but like that very low dose, very very low doses. And I was like, I was up front. I was like, I just don't want to be.
Snowed by medicine. Yeah,
Yeah.
but here's the thing you got to remember. You are okay. Couple like myth debunks. Okay, one, psychiatric medications don't treat chemical imbalances. There's no such thing as a chemical imbalance. There is
Mm,
no such thing as a chemical balance. Nobody can do a blood draw or an assay and say, well, you have a perfect balance of serotonin, dopamine, and norepinephrine in your brain.
yeah.
This is balanced and this is imbalanced. That's not real. Okay. That's a analogy that people erroneously use, but it's not correct. Instead, you're just adding a compound to see if it has a desired effect.
Got
And
it.
there are some compounds that have been shown in large groups of people to help them achieve a desired effect. That's what it does. So you're not going to find the perfect medication or dose that's going to fix you. That's not the right way to look at it. You might get a compound added that helps you achieve a desired effect, and that would be great. And you may need to try a few different compounds and a few
Yeah.
different doses to get an effect that you more or less like.
I
That's
I
okay.
I
It's not
understand.
going to be correcting a chemical imbalance.
Yeah.
That's not it.
I will say just a personal thing I did and that Allie did and is I don't know. And again, this is all such emerging science and stuff like that I understand that this might just be total pseudoscience, whatever. But there is like a company, Gene Site, I think it's called, and they do a genetic. It's like a 23andMe, but they take your info of your genome or whatever, and they put it up against like studies that have suggested um, interactions with different psychiatric medications, and they say
Mm.
like and they can't it doesn't say like we recommended this or not this. They just say if they have shown, just like when you do a regular one, and it says like, because it's all maybes, it's all like maybes, that like you might have an interaction, a low chance, or you might have a more intense reaction, a higher chance, but it's all mights, right? It's like saying like you might have blue eyes, you might have brown hair when they do the 23andMe. And I did that, and Allie did it first a while ago and used it to change and ended up changing her medication based off it because it said that something she was taking she maybe had a serious interaction with, and she did change it, and it fundamentally it was right, and it helped her a lot. And then I did the same thing, and it it seems to have also helped me. They have like some, it's expensive if you have money, and if you don't have money, there's some like very cheap for like it has like a financial aid component, and I will just say that helped me a little bit in selecting and what I was going to try. I did have to do it through my psychiatrist. Like you have to have a doctor to do it. You can't just like go sign up for it. But anyway, do you have any thoughts about that gene site stuff?
Uh, I'm not aware of that specific site. I'll look into it. I'm always skeptical.
Yeah.
I don't know that we have a large enough database of genotypes to be able to
Right.
cross analyze with specific psychiatric medications. I just don't know what that database would look like or where it would come from.
Right. Right.
But I just may not understand it because I haven't
Right.
looked in. Like everything else, I would be skeptical, but I would
For sure.
talk. The place to start is with a good psychiatrist.
For sure. Which on that note, Emily asked, like, can you make these kind of appointments right now during COVID? And this is an interesting question because the first half of this was saying that, like, I had a refill on my antidepressant left, so I got that refilled. But at least in California, I don't know if other states, you can't. I'm not allowed to have refills on my Adderall. I guess because it's a stimulant and probably like Schedule 1 or some shit. But like, who knows? But it's like, or not Schedule 1. That'd be 2, right?
I don't know. I
Who
mean,
fucking
marijuana
knows? DEA, who knows?
is
But
great.
but anyway, so I am basically out of Adderall, and that's very interesting experience for me. That I'm not excited at seeing the continued rollout of it, and it's given me a lot of weird thoughts. But my understanding is, in texting with my psychiatrist, that there is some protocol in place now that she can do something over video because we can't meet, and that's why I'm out. And so we're supposed to try that at some point this week. I don't know. We'll see.
Yeah,
So
I mean,
I assume. Do you know about that? Can somebody make a video?
I mean, the answer is it totally depends on the system, public or private, on the individual practitioner. It depends, but psychiatrists can do telehealth and prescribe uh,
Oh,
medications as a result of a telehealth appointment. So,
okay.
depending on the practitioner, it's mental health care is one of those things that telehealth is really set up well to do. So yeah, you just have to find someone who's willing to do a telehealth appointment. But I think everybody's doing them now, so
Yeah.
lots of therapists are doing telehealth, lots of psychiatrists are doing telehealth. So I'm sure it's going to be slower and more difficult, like everything else is right now.
Right.
But the short answer is yes, you should be able to set up a telehealth consult with a psychiatrist. Yeah.
Yeah. Okay. Well, oh guys, I think that's good. We're at 11:04. I'm so sorry that I keep futzing off with the fucking tech stuff. But I'm gonna go right after this. I'm gonna quickly assemble last week's episode, and this one I'll
We're
pop
just
them up.
two dudes. We're just two dudes talking, man. We're not. We don't
We're
have
just two
Jamie
fucking
in the
dudes.
back doing production.
I
So
know. I'm the producer of this and everything. I mean, so many other things. So thanks for being here. Thanks for y'all who hung out before we were even live. I can't believe I'm such a dipshit about that. I appreciate you. We're gonna do quarantine calisthenics at noon today. As usual, I think I'm going to talk there about like how I might adjust the schedule. I still like showing up every day for something, but we're going to have to change the schedule just for like the fatigue on the body, I think, building a rest day and stuff like that. Emily, thank you for being so open about that, the question and stuff. Yeah, it's really nice. It's really generous of you too to like be open about it and let us have that conversation with you just live like that. And if anybody else wants to do stuff like that, you're always allowed. Um, Okay, I think that's it for today. Thanks, Nick. Thanks for being here again, man. We'll see you guys next week. You can go to mygoodbadbrain.com if you want gear. There's also quarantine gear. So if you're on the quarantine calisthenics crew, thanks to Rogue Avocado, she made a really fun little logo. I've ordered a bunch of gear. I'm gonna somebody requested a hoodie, so I'm gonna go make a hoodie in the store.
I'm gonna have to get some swag, man. I
It's
gotta
fucking
take.
good. It's pretty fun. It's like this funny, like it's cool. It's like a COVID virus that just says quarantine on it and it's sweating. Silly. All right. Guys, thanks a lot. Like I said, I'll post these up and we'll see you all next week. All right. Be well. Self-care. Hydrate. Love you. Bye.